section is on documenting skin to skin and initial breastfeeding. So, depending on how your bands are set up, the first thing that you want to make sure you document is the time and date of delivery. So if you go under the delivery band, and the first thing is labor and delivery information, and then down here is the time of birth. And the reason you want to make sure that date and time is in there, a lot of these other times kind of, you're looking at the time of birth and seeing how long you started the skin to skin or the breastfeeding to see what time. The next band you would go down to is labor and delivery recovery. In the first section, recovery postpartum, the skin to skin and breastfeeding is all kind of together here. So if you go to skin, was it initiated within 5 minutes of delivery? This line gives you a drop down of yes, no, or refused. So yes, for if it was done within 5 minutes, no. You can either hit other and annotate it was not done for 10 minutes after delivery due to, mom was unstable in like a C-section, and they could not, she was hemorrhaging and they could not do skin to skin because of that, or maybe the baby was having trouble, baby was blue and needed attention from the nurses and doctors in the infant warmer and could not do skin to skin. So just annotate why and what time you started skin to skin. You can actually do that. It's probably better on this line, skin to skin initiated. It is just a big box for, narrative. You can put the time. This was 15 minutes after delivery and why. Then skin to skin, who? It's a drop down box, mother, father, a baby, or other. So you can pick grandma or whoever was available to do skin to skin because maybe mom was in the middle of a hemorrhage, so somebody else had to start the skin to skin. The next section, you put the duration, and we would like it to be 60 minutes or longer. So if you did not do 60 minutes, you can either right click and flag here why you could not do the 60 minutes, because maybe baby started having respiratory problems and needed to be taken to NICU. Here you put, it's just a narrative box. You put the time that you stopped, and this is also another place you could right click and put why you stopped before 60 minutes. Then there's the initial breastfeeding initiated. That one's just going to let you put a date and time for when you started the first breastfeeding, and then you would put the minutes in for the total time at the breast. This documentation is done more in labor and delivery recovery, but as postpartum nurses, we should either check the chart before the patient comes out to see if this was filled in, or when you're giving bedside report, you can open up the chart and look at it then with the labor and delivery nurse, and then remind them that they do need to fill in those times. Occasionally, a patient will come to postpartum that has not done the initial breastfeeding due to mom being unstable or such. So that would be the time the postpartum nurse would start the initial breastfeeding and put why it was delayed until they got to the postpartum unit.
So Jill, if a mom doesn't want to do skin to skin because she's maybe in pain, say if they're doing a fourth degree repair, it's okay if she doesn't do skin to skin, just as long as we document why. Is that correct?
Document why, but really encourage, that even though she's in pain, she could still do skin to skin, and that might take her mind off the pain. And either that, encourage her to do it, try to set up the baby where it is not making her pain any worse, try to encourage her that will help her with her pain, or dad or grandma, somebody else in the room could do the skin to skin if she was okay with that.
Thank you.